Hello everyone, welcome to today's segment series provided by Beaumont Health System. I am Sameena Syad. I'm a physical therapist in the Beaumont Health System, and I'll be your guide as we navigate to our topic today, help for pelvic pain and incontinence. This has been a topic that is very embarrassing for people to discuss with one another, and sometimes patients don't even report their symptoms to their own physicians. And most of the patients think that this is just part of natural aging. Here with me is Kristie Wilson. She is a physical therapist at Beaumont Health System as well, and she'll be providing us with our information today, our topic which is help for pelvic pain and incontinence. Welcome, Kristie.
Hi, Sameena. I am pleased to have this opportunity with you to share our knowledge about getting help for pelvic pain and incontinence.
Let's begin by sharing who we are and what we do. Kristie and I are physical therapists, and we specialize in pelvic floor rehabilitation. Like other physical therapists, our goal is also restoration of function.
We work with muscles, joints, nerves, and soft tissues and organs of the pelvis and abdomen. We treat individuals who have urinary or bowel issues such as incontinence and pelvic pain. More specifically, we treat pelvic floor muscles that cause or contribute to these symptoms. We see men, women, and children who are suffering with these issues.
Many people do not realize that there is physical therapy for that area of the body. I see patients who come to me and they say they simply did not know that there is physical therapy for that area until their physician has referred to them to pelvic floor rehabilitation. By educating others on pelvic floor rehabilitation, I hope we can reach out to people who can really benefit with these treatments. So Kristie, could you tell us what the term incontinence means?
Sure, Sameena. Incontinence means the leakage of stool or urine. Leakage can occur accidentally with or without awareness that it has happened. Urinary incontinence means leakage of urine, while fecal or bowel incontinence means leakage of stool or gas. A person that is incontinent can have one or more types of leakage.
Very good. We provide treatments for both urinary or bowel or fecal incontinence. So could you tell us what pelvic floor means?
Sure. I would like to show you a picture as I explain. The pelvis is made up of bones, muscles, nerves, and blood supply. The pelvic bones serve as a supporting structure for our vital organs and for everyday movement. A group of muscles referred to as the pelvic floor help provide additional support. Here is a picture showing the pelvic floor. This picture is an example of pelvic floor muscles in a female. The colored portions here make up the outermost layer of the pelvic floor. Believe it or not, the pelvic floor, with slight variations, looks very similar in a male. On the next slide here, we have the pelvic floor shown in a male and in a female. The pelvic floor is situated at the bottom of the pelvis. The deepest layer of muscles extends from the front of the pelvis to the tailbone, and it's here shown in red. They help the pelvis support the organs.
The pelvic floor muscles are a very important group of muscles. When I educate my patients regarding pelvic floor muscles, they often tell me, I wasn't aware we even had muscles down there.
And I hear that from my patients too.
Yeah, so can you mentioned like layers of muscles of pelvic floor. Could you give us a little bit more details about it?
I sure will. There are 3 layers of muscle in the pelvic floor, and they act like muscles in the rest of our body. They need to be strong, and they need to be able to contract and relax to perform their functions. Let's take a look at the next slide as I explain. We have already discussed that one role is to provide organ support. The pelvic floor also controls the opening and closing of our urinary and bowel systems. When the pelvic floor contracts, it allows the bladder to store urine. When the contraction occurs, it also allows the rectum, which is the lower portion of the large intestine, to store stool. When we excuse ourselves to use the bathroom and sit on the toilet, the pelvic floor muscles relax, allowing the bladder to empty, and if needed, the rectum to empty. Next, the pelvic floor is also responsible for the orgasmic pleasure experienced during sexual intercourse. Muscles in the pelvic floor also provide stability of the pelvis during movement. Finally, the pelvic floor assists the lymphatic system in the movement of fluid.
The pelvic floor is a really important group of muscles. As pelvic floor rehab therapists, we are constantly working with these group of muscles simply because they are not performing as they should. So Kristie, could you tell us what kind of problems that are experienced with these pelvic floor when the issues arise?
Yes. Pelvic floor physical therapists treat individuals whose pelvic floor muscles are not performing as they should. When the pelvic floor does not function properly, we refer to a term called pelvic floor dysfunction. Pelvic floor dysfunction can lead to bigger issues since the pelvic floor helps regulate bowel and bladder functions. You have probably experienced muscles in your body that have become tight or overactive. The pelvic floor muscles are no different. Let's take a look at the next slide, and I will show you what can happen when the pelvic floor cannot relax. A tight or overactive pelvic floor may cause pelvic pain, pain with urination, pain with bowel movements, with sexual intercourse, and it can also cause constipation or urinary retention.
These are some real problems that are seen in both women and men. To add to what Kristie just said, a person with tight or overactive pelvic floor can have one or more symptoms at the same time. So Kristie, describe to us what happens when these muscles are really weak.
Like other muscles in the body, the pelvic floor can be weak or underactive. This type of pelvic floor is too relaxed. Let's move to the next slide. A weak or underactive pelvic floor may cause leakage of urine or urinary incontinence and leakage of stool or fecal incontinence. Pelvic pain can result from a weak pelvic floor. Weakness in the pelvic floor can also contribute to pelvic organ prolapse. We have organs that are held in position by the pelvic floor and other soft tissue structures. In a prolapse, one or more organs moves or drops to a lower position in the pelvis.
Physical therapy can be beneficial for patients having both bowel and urinary conditions. I have treated a number of patients, both male and female, who think that having urinary leakage or having a prolapse are just simply signs of natural aging.
This is a common myth, but in truth, these symptoms are really not signs of aging. Any of these problems can get worse over time if left untreated. Incontinence is a big issue in this country, and I have some statistics here to share with you that illustrate the scope of this problem. Urinary incontinence affects 200 million people in the world and 25 million people in the United States. 75 to 80% of people who have urinary incontinence are women. And this one I find really astonishing. 2/3 of men and women have never discussed their bladder health with their own physician. More than 50% of all nursing home residents have urinary incontinence. And urinary leakage is the second leading cause of institutionalization.
Amazing, Kristie. Those numbers are astounding. Many people are suffering with this incontinence issues, and there is help for these issues. pelvic floor physical therapy is really beneficial with patients with bladder and bowel issues. Rehabilitating the pelvic floor muscles restores the functions of the pelvic floor. Well, Kristie, you mentioned earlier that physical therapy can be beneficial for children as well. Could you explain to us a little bit more? I know there are listening parents who would really appreciate with more information on this topic.
Sure. Children can also have pelvic floor dysfunctions. Issues with the pelvic floor, bowel, and urinary symptoms can also occur in children. Physical therapy can benefit them too. I will show you some of the latest statistics we have. Urinary incontinence, or leakage of urine, affects 15% of girls and 22% of boys. That equates to 5 to 7 million children in the United States. The estimate is large because urinary leakage is largely underreported. 10 to 25% of children who wet the bed also have daytime urinary leakage. Now, on the issue of fecal incontinence or leakage of stool, 1 in 3 children with this type of incontinence also wets the bed. Statistics also show that 1 in 5 children with fecal incontinence has daytime urinary symptoms such as urinary frequency and leakage.
I know that there are parents out there who are really struggling to get a grip on their sons or daughters' urinary leakages like nighttime bedwetting and daytime incontinence. They would really benefit to know that there is some help for the child and can get some peace of mind.
I agree. Bedwetting alone is not considered an illness. Surely, bedwetting issues and daytime leakage have large social and psychological impact. The child becomes aware of the problem and wants to avoid embarrassment. So he or she may limit social interactions just to avoid an embarrassing episode. Sleepovers may get turned down, trips away from home may be refused, and school days may be missed. Mm-hmm. The issue can cause poor self-esteem and feelings such as anger, shame, and guilt. Parents try to help their children the best they can, but often exhaust methods to help them without any lasting results. We can understand how a parent can get frustrated by failing to help the child with their incontinence issues. Knowing that pelvic floor dysfunction in children can have a profound impact on a child, Beaumont's Children's Hospital sponsors a rehabilitation program just for children ages 5 through 17 years called the GROW program. GROW stands for Get Rid of Wetness.
The GROW program is being recognized as a valuable program by children and their parents. Beaumont offers the services at all of its locations that offers pelvic floor rehabilitation. Kristie, could you share us some of the treatment options that are available for someone with a pelvic floor problem?
Yes, Sameena. There are a variety of treatments available to address pelvic floor problems. Here are some of the treatments and skilled techniques that can be used. The types of treatments chosen depend upon the information the physical therapist gathers from the initial evaluation with the patient. The therapist then determines the most effective treatments for that patient. At Beaumont, our treatment programs are based on the most current research. Our treatments are also evidence-based. That is, the treatments are known in research to make a true difference in symptoms of pelvic floor dysfunction.
There's a lot of treatment options to offer, and like you said, it really depends upon the issue a person has that makes a difference on the type of treatment he or she will be receiving. At Beaumont, we have an individualized treatment approach to meet specific needs of a person and their concerns. So Kristie, where does a person with pelvic pain or urinary incontinence or bowel incontinence begin their journey for achieving better health?
My first recommendation to anyone who's having symptoms such as incontinence or pelvic pain is to call your primary physician. If a child is having any of these symptoms, call your child's pediatrician. You need to make an appointment with a doctor. If you are already seeing a specialist, such as a urologist, gynecologist, gastroenterologist, or colorectal specialist, you ought to contact your physician's office. It is important that you tell your physician all of your symptoms to help them make an accurate diagnosis. If you're interested in a conservative treatment option, ask your doctor if physical therapy may be a good option for you.
That is some good advice. Don't ignore your problems. Call your doctor, report your symptoms, and ask if physical therapy is right for you. Now, as we wrap up, Kristie, can you tell us where can a person find a physical therapist like you who specializes in pelvic floor rehabilitation?
The Beaumont Health System has skilled physical therapists who specialize in pelvic floor rehabilitation. Locations providing pelvic floor physical therapy are listed on this slide.
Beaumont offers multiple treatment locations for physical therapy and patients who require physical therapy in pelvic floor rehabilitation. Beaumont has become a leader in treating pelvic floor conditions. Beaumont Health System is also the largest health system in Southeast Michigan, offering pelvic floor rehabilitation in multiple locations. We have the LIFT program that offers treatments for pelvic floor weakness. We have the pelvic pain program that offers treatments for pelvic pain and dysfunction. And we have the GROW program that offers treatments for children from ages 5 to 17 years. Our treatments are very effective because they are evidence-based, and our therapists who treat pelvic patients are specialized and they are keeping up with latest advancements.
We appreciate this opportunity to share with you our knowledge, and we hope that you feel more knowledgeable about pelvic pain and incontinence, including why it may occur and what type of conservative options are available for treatment. We hope that this discussion encourages others to talk to their doctors about their personal pelvic issues. There is help available for these conditions.
Thank you.